Welcome to Talley's Forum on Wireless Communications. I'm Eric Schiebler, VP of Talley's Customer Experience Team. I'll be your host for the next 10 to 15 minutes as we explore the world of wireless communications. This is our third episode in a series of podcasts focusing on the wireless industry. We hope you find this podcast both interesting and informative. Today's topic is the Internet of Medical Things. IoMT is a collection of medical devices and applications found in healthcare facilities that connect information technology systems via wireless infrastructure. The purpose of the podcast is to introduce Talley customers currently working in the in-building DAS/BDA space to the quickly growing IoMT business sector. The podcast will also focus on essential test and measurement products for this application. My guest today is a valued partner to Talley who I've had the pleasure of working with for many, many years. I truly respect his industry knowledge and his technical expertise. Gregg, would you please kindly introduce yourself to our audience?
Thank you, Eric, and thank you, Talley, for inviting Anritsu to today's podcast, focusing on the Internet of Medical Things and the direction the industry is taking here. My name is Gregg Toback, and I am a national sales manager for Anritsu Company. For the past 13 years, I've been involved in planning, implementation, and testing of high-performance wireless networks and wireline networks.
Great, thank you, Gregg. So why are we talking about Internet of Medical Things? The IoMT market is projected to exceed $800 billion by 2030. That's significant. Gregg, what growth opportunities do you see for companies that want to enter the sector and expand their current role in the space?
The increased use of wireless medical equipment and telemetry really requires a new focus on how to optimize in-building wireless coverage for seamless patient mobility and uninterrupted monitoring. And companies that are interested in or who previously constructed, maintained, and optimized wireless and wireline networks have a special skill set that open the opportunity for them to apply these techniques toward ensuring seamless in-building connectivity in the wireless medical telemetry application.
Yeah, very true, Gregg. I can recall a time 10 to 15 years ago when basic cellular coverage, just the coverage itself, was a major concern in the hospitals. All these large campuses with many buildings that inevitably had a lot of weak coverage areas. And now the hospitals are looking to have their wireless networks gather information for patient monitoring, tracking of patients, of equipment. So capacity and coverage are critical now in every inch of this campus. It's going to sound dramatic, but connectivity to these devices can literally be the difference between life or death. Coverage is no longer going to be a nice to have add-on for the hospitals. So there's absolutely a business case, I believe, for DAS and BDA integrators to upgrade wireless coverage in the hospital facilities.
Most definitely, Eric. Medical telemetry creates a need for delivering 24/7 patient monitoring of what's now mission critical applications. When you're admitted into a hospital, often you're encouraged to have mobility as an increasingly important part of your recovery plan.
Right.
And hospitals need to encourage that mobility while assuring patient safety, to enhance the healing process, and also to arrange for a timely discharge of the patient. So maintaining and knowing the whereabouts of this expensive medical instrumentation is quite complex. And to do that, a properly designed and supported DAS and BDA system delivers on the hospital's commitment to providing that excellent patient care, and most importantly, doing it within budget.
Yeah, absolutely agree. Keeping it within budget is definitely top of mind for those hospitals, for sure. I definitely see a huge growth opportunity for the integrators who can take the project all the way from A to Z, determining the customer's needs, providing design assistance, performing the spectrum analysis, creating a scope of work, installing the system and doing the closeout, et cetera, et cetera. But the integrators, the challenge now also is they'll be required to work with the hospital's IT team to make sure the network is secure due to the sensitivity of medical data.
Absolutely, Eric. So some of the most important aspects when you're commissioning a successful in-building DAS and BDA system happens during the design phase. So that DAS and BDA integrator or end user, if they're doing it themselves, needs to understand where they will encounter these challenging coverage areas, what might cause interferers. And interferers could be identified anywhere on campus, but especially are prevalent in areas like surgical suites, X-ray and MRI rooms, skybridge corridors between buildings, power generation, storage areas, and just general public patient space. So performing an in-building RF survey of the entire facility improves the DAS and VDA designer's knowledge for antenna placement and good RF planning. These good RF plans translate into faster installation, commissioning, and again, on budget completion of the project.
Right. I mean, those are really good points to consider, because just picture yourself walking through the hospital like you kind of took me through, all those different environments that need to get coverage. It's going to take a lot of pre-planning. So you're spot on. In that pre-planning, in those spectrum analysis, that's where you're going to make the commissioning go smoother if you have the pre-plan, 100%. So good point there, Greg. And there's also applications outside of the hospitals, right? There's remote patient monitoring once they're discharged. Is that going to be done on a private network? How do you see that being implemented, Greg?
So there are definitely challenges when you're designing this RF or optical transmission system inside the building. So two things to consider. When you're in the building, you have to be aware of the bandwidth you have available. What data security methods are you implementing? Do you have a VPN for communicating sensitive HIPAA information securely? Do you have dedicated optical transceivers? Do you have redundancy? Do you have backup? Is the backup HIPAA compliant?
Right.
Now, when you go outside to contract with a service provider for remote patient monitoring, is there a service level agreement in place? If you don't have a service level agreement in place, you do not have any confidence that the critical communications performance is going to be delivered. That's a very important part of the synergy when you're considering moving that in-building network into outside of the hospital.
Yeah, and do you feel like, for coverage wise, do you feel like it's best on a more robust type of network, like a Verizon fixed wireless access or an AT&T network, one of the big boys? But it's thinking out loud now, it's probably more dependent on the coverage where the hospitals and the patients reside, right? So if it's extremely rural, it'll likely be on a private network or some combination. What do you think?
Yeah, it is that combination. We often ask these questions on a case-by-case basis. There many times will be a integration of a private network from the hospital with a public network that might be a ruggedized level of service from Verizon, AT&T, or some of our tier 2 or tier 3 carriers.
Right.
It is very important to consider the overall performance of the system.
Definitely. Well, now, you can also tie this into my next point, where you also have to tie it on the internal systems as well. So, we've discussed the hospitals having like network operation centers, the NOCs, in their facilities, because there's so much critical information that they need to monitor 24/7. What do you envision that look like? Do you think that the healthcare facilities will be subcontracting the monitoring and the management of their NOCs?
It largely depends on the size of the hospital network. A larger multi-hundred bed facility likely has the resources to monitor their own remote spectrum solution, putting dedicated hardware, software, and oftentimes in-person technical resources that can quickly identify and mitigate interferers. Alarms create calls to action, and that can be very stressful on a hospital network whose primary focus is patient care. So it will be common to see outsourced companies, such as many of Talley's customers who are experts in EF&I projects, to offer the expertise as a subcontractor to monitor, maintain, and mitigate the potential interferers that occur on a daily basis.
Yeah, I absolutely agree. So I feel like we set this up pretty good as far as the business case. Like, hopefully we've shown our audience great opportunity here in the IoMT space. To get started, they're going to need some test and measurement equipment. So, what do they need to scope, install, and make sure the systems are operating properly? Can you please speak on the equipment, in particular, remote spectrum monitoring?
Absolutely, Eric. Happy to do so. So during that system planning, the installation, and the maintenance stages of these critical healthcare networks, Anritsu has a number of instruments that can be applied as handheld spectrum analyzers to do that initial study and the ongoing preventative maintenance. Our Fieldmaster series of spectrum analyzers covers from 9 kilohertz up to 6 gigahertz. And for hospitals that are looking to deploy FR2 or higher frequency RF applications, we have a model called the Fieldmaster Pro, which supports up to 54 gigahertz. These analyzers can be combined with custom software that allows the user to produce an accurate 3D in-building coverage map. Why that's important is oftentimes the DAS contractor has to make sure that the system complies with National Fire Protection or International Fire Code requirements. And the maps that are generated by the Anritsu Spectrum Analyzer are 100% compliant with these codes. So in addition to designing an optimized system, your Anritsu Spectrum Analyzer can be used to meet the critical NFPA and IFC code compliance requirements. When the system is installed, we need that ability to look for intentional and rogue interference sources, identify them within seconds, 24 hours a day, 7 days a week, and we can't do that with a handheld spectrum analyzer. So we introduce Anritsu's remote spectrum analyzer, which at a high level is an analyzer that consists of multiple spectrum analyzers controlled by a single source using Anritsu software or a web interface. That can be tied directly to the hospital's network operating and alarming systems. It overlays with the map you created with your handheld spectrum analyzer and gives you that 24/7 monitoring. And then finally, when you consider what is feeding these pieces of test equipment, it could be coaxial fed, it could be optically fed. Anritsu Company has a family of optical testers, such as OTDRs, power meters, light sources, and transport testers that can validate the performance of the backhaul, which is needed to make sure you have a robust system in your RF communication.
Yeah, I mean, just hearing the full suite of products that Anritsu offers, it makes it very convenient and productive. Like you said, the equipment's GUI and the logical functionality, carries over pretty much from product to product. So I find that that's quite an advantage when you're looking to not piece out all the types of equipment that you're going to get. If you can keep it kind of homogeneous with one brand, hopefully Anritsu, that's going to be a big plus for ease of use, I think. Greg, thank you for those recommendations. As I mentioned before, you and I have worked together for many, many years. How do you feel Anritsu's distribution partnership with Talley has created success for both of us?
As we've seen over the years working together, Talley is an invaluable stocking distributor partner to Anritsu. The local sales professionals that you have calling on customers on a daily basis expands our ability to educate and sell our instruments. We recognize that Anritsu products are a small part of a DAS system. And when that DAS integrator comes to Talley asking for infrastructure products, power conversion products, and other infrastructure related items, test equipment is a natural conversational point of discussion that all of the Talley salespeople are very, very proficient at introducing. Talley delivers with the in-stock access. Anritsu manufactures on a to-order basis. So we will often be quoting weeks to deliver a product, where Talley has it on the shelf and can address immediate needs of our customers with the same level of satisfaction. And we offer 100% of the Anritsu application engineering and product support as a seamless partnership.
Yeah, absolutely agree. And I'm going to flip it back towards you. We get amazing support through Anritsu. We've been able to secure loaners for our customers who are not really familiar with the machines, or they need one quicker than we can deliver. Sometimes we'll rent a loaner. We've gotten field support from your team. We've gotten training sessions. It's just an amazing working relationship we have. And, in my opinion, Anritsu has become the industry standard for the handheld test devices. And, everybody knows Anritsu, everybody's familiar with Anritsu, and it really has to do with the support and the push from your team to make it easy for new or existing customers to use the equipment. So to our audience, I'm hoping that you found today's podcast informative. and we've given you some forward-thinking business considerations. So remember that IoMT segment is going to be an $800 billion market. Hopefully you're starting to spin the wheels on how to get part of that revenue. Gregg, I'd like to thank you and Anritsu for being our guest today. Do you have any final thoughts you'd like to share with our audience?
I do. And Eric, thank you again for the opportunity to share at a high level how the Internet of Medical Things is changing the way communications are managed and influence that they have on patient safety. One thing that perhaps some of our audience isn't aware of is that all of the Anritsu RF handheld equipment we've been talking about is designed and manufactured in the US. We are proud owners of property in Northern California, where we maintain our factory, our engineering, product marketing, sales. And the benefit of that is we develop equipment to be used by field technicians and engineers that have similar or the same support as more expensive laboratory equipment, are optimized to be used in very harsh environments, such as the environments we see in the field. We absolutely welcome the opportunity to learn more about your customers' needs and working consultatively to select the most applicable, cost-effective, productive, and profitable instruments to make your DAS solution a success.
Yeah, and there's definitely a need for that, and customers will definitely appreciate you helping them pick the right gear. So, Gregg, what's the best way for our audience to find, contact, or connect with you?
To reach out to me directly, you're most welcome to contact me at my email. It is gregg.toback@anritsu.com, and that is gregg.toback@anritsu.com. To learn more about our products and solutions, please visit our website at www.anritsu.com. In addition to data sheets, product information, there are application notes, and we also have an entire library of no-cost e-learning classes, which you can take at your pace. There is no obligation, no salesperson will call. They're purely educational and informative to help you use the test equipment in the best way possible.
Awesome. Well, thank you again, Gregg, for being on the podcast. To our podcast audience, we know your time is limited and important, so we thank you for spending a portion of it with Talley today. If you find our message informative, please subscribe, share, or provide positive feedback on YouTube for us. Again, thank you all for listening, and I hope you discovered ways to succeed in this booming IoMT market.